Some people know what they want to say or know what they want to write, but they simply have trouble saying it or even writing it. Other people with aphasia actually may hear a voice or may read something on a paper, but they can't make sense of the words that they read or that they hear. Both of these are examples of aphasia. We're talking about that today, guys. I'm going to tell you exactly what aphasia is, what the symptoms are, who gets it, what the treatments are, what you should know. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. So first thing you should know is that aphasia basically is a disorder. It's a condition that affects someone's ability to express and understand language, reading, and writing. That's the bottom line of it. And basically, it's a disorder that results from damage to the parts of the brain that control language. I oftentimes think about it as a symptom. It's a symptom of something else. It's a symptom of some sort of damage to the brain. Examples can be things like brain tumors, strokes, progressive neurological diseases, Alzheimer's disease, and other things like that. Head injuries, blows to the head, and plenty of other things that if they affect or injure the part of the brain that deals with language and controls language, those folks may end up with some sort of aphasia or symptoms of aphasia. Now, this is the thing. There's different types of aphasias, and many people may have different symptoms. I've told you a couple at the beginning of the video. I'll repeat those. Expressive aphasia is one that I mentioned. That's when the person knows what they want to say, but they have trouble saying it or they have trouble writing it. There's also receptive aphasia. That's the other one I mentioned. You hear a voice or you see print, but you can't really make out or make sense of the words that you're hearing or seeing. And then there's anomic aphasia. That's where people have trouble using the correct words for objects or places or events. They just can't pick the right word. And then there's something called global aphasia, which is where people really can't speak or understand or read or write, okay? Now understand, there's a continuum, there's a spectrum, all right? Those are sort of four broad categories of aphasias. There is a spectrum. There are many, many different types of symptoms that can fall within this category of aphasia that people may have. Those are just four broad categories to give you kind of an idea of what people may experience. So when you say, okay, well, all right, so this is caused by damage to the brain, the area of the brain that affects language, and a symptom of this can be an aphasia. Well, what's the treatment? Well, because I think of it as a symptom, the treatment often has to do with the initial injury, meaning the cause, right? Was it a stroke? Was it a head injury? Is it a progressive neurological disease? And oftentimes, whether the aphasia improves, resolves, recovers, does not improve, etc., how fast, how slow, depends on the underlying injury that the person has sustained. What's really important to understand here, however, is that speech-language therapy is very, very important for folks with aphasia. Speech-language therapy is key, honestly, and it's one of the mainstays of treatment for so many patients who are dealing with aphasia. So understand that in addition to sort of dealing with the underlying cause that your doctor and your healthcare providers are going to be doing, speech-language therapy is very likely going to be a big part of this. Guys, I hope this is helpful, at least to give some idea about what aphasia is. Now that you know, you may be able to think of people that you've known in your life who've had some type of aphasia, maybe people that are close to you. Let me know in the comments if you know people who have an aphasia, if they've gone through this, etc. It's a very important symptom that really affects people's quality of life. So I hope this is helpful. Let me know again in the comments. If you've not liked and followed my page, by the way, please do. I do daily videos and all sorts of stuff. For those of you who send stars, I respond personally. Thank you so much. Guys, oh, and by the way, for those of you on YouTube, hello, thank you for joining me. Please subscribe to my channel and click the little bell for updates. Guys, I'll be back with new content very soon. Please consider joining my subscription groups as well. I'm Dr. Jen Caudle. I'll see you soon.